you treat addiction always first. I learned even in my studies that a clinician and or medical professional should always assume that the behaviors are a result of the substance use unless proven otherwise. You can't diagnose mental illness while somebody is under the influence or shortly after. And even those families are watching this and say, well, they were like this before they used. Well, that still doesn't mean it's mental illness, because you got to remember, addiction is caused by behaviors. So a lot of people dealing with trauma and uncomfortable thoughts act out in different ways. And they use whatever they can as a coping mechanism. And then, they go into depression, they go into these things. They go into anxiety, they have bipolar episodes. And then they find substances to self-medicate. I've seen more people go to treatment for addiction, work a program of recovery, have a great therapist and great group facilitation to work through the problems that stemmed even from their childhood, and they didn't have any mental health diagnosis. And again, there are true mental health diagnoses. There are people with depression and anxiety and bipolar. We understand that. But when there is a substance use disorder, even before the person ever used, is it their coping mechanisms that cause the mental health symptoms? Or is it truly something in their brain that's literally a mental illness? I mean, I even think about when I watch pharmaceutical commercials. They don't tell you anything other than it is thought to work by. They don't even know. They give you these, these serotonin reuptake inhibitors, and they try to balance out your thoughts. What if we can address those thoughts through therapy and recovery programs? And if that doesn't work, then we go down the road of mental illness. I mean, if they're not in danger with depression and suicidal thoughts, and it is a mental problem in the way that they think, and there's no danger of them harming themselves or others other than they're uncomfortable in their own skin, why not utilize therapy and put the addiction first to see where we're at and then make those diagnoses later?